We had several questions come in around Epic, and we kind of boiled it down to, with the rollout beginning soon, what steps are we taking to ensure it's a smooth process and that everyone's ready?
Well, we began 2 years ago to make sure it's a smooth process, and we put together a team that we've called Health Improvement Partners, HIP, and we've now been using the term Epic One because we're all going to be on one Epic system by the end of 2018. And so we have a project team that's been leading this initiative, but obviously in partnership now with all of us across any nook and corner of BJC. There have been weekly, daily training meetings. I mentioned training space out at the BLI. Well, we've got training space on the WashU Medical Campus. We've got training space. I was down at Sullivan last week, and they're going to be taking a number of their administrative offices and converting it into training space. We have training space out at Boone Hospital that will come up on Epic in August. So we've taken over spaces in all of our HSOs for on-site training. That training becomes very real when you're about a month out from going live. But let me share with you what happened this past weekend. So we go live on Epic Saturday, June 3rd. So just 10 days or so from now. This past weekend, out at the BLI, there were over 600 individuals, combination of the HIP project team members, but the majority of which were BJC Medical Group employees and physicians. And what they were doing, they were beginning to register patients into the Epic system. So if we couldn't wait till June 3rd, we've got patients that are calling in now to get appointments, later in June. So we said we got to bring up Epic. So over the weekend, they started to input registrations into Epic. And then they also started to convert, and I think they converted 150,000 appointments from the old Meditech, old NextGen system into the Epic system. They worked basically almost 18-hour days, Saturday and Sunday. The reports coming out Saturday and the reports coming out Sunday and the report that came out this morning was all systems go. It was very, very successful. Always a little bit of things we got to tweak, and the team will tweak those this week going into the June 3rd go live. But we're putting folks at the elbow as we go live with the medical group. And so as we sit here today, this is wood, right? We feel very, very, very optimistic about our success beginning with the medical group. So to the BJC Medical Group colleagues, thank you all for going first and helping us get some experience with Epic. And then we'll turn to our Boone Hospital colleagues. I think we go live in Boone on Saturday, I think it's August 5th. And then we get into a cadence where we bring up a pot of community hospitals in December, the next pot of community hospitals in February of 18, and then the academic campus, BJH Children's Hospital, West County Hospital in June of 18. And then our Memorial colleagues, we save you to last because you are on Meditech, a different system for us, and we'll bring them over to Epic and Sorian at the end of 18. Big project, but it's a strategic imperative for us because it is going to help us improve the customer service for our patients and provide better tools for our caregivers to elevate the experience for our patients and for those that work within our electronic systems.
Exciting stuff.
Yeah, it's very exciting. This weekend went so well. It was great to see everybody in action. I had a chance to drop by Saturday afternoon at the BLI, and it was very impressive to see everybody there sort of heads down, playing in the new system.
And one of the questions is the last phase of the Epic project going to be converting Sorian to Epic and decommissioning Sorian?
As of now, the last phase of the Epic project, I think I said this as we went to break, was to bring Memorial up live on Epic and Sorian. And so we're going to get to the end of knitting Epic and Sorian together. At the same time, we do continue to evaluate the functionality of the Sorian revenue cycle and the Epic revenue cycle as we bring up the medical group. The medical group and the Washington University faculty practice plan will come up on Epic Clinical and Epic Rev Cycle. So we'll have a good comparative side by side. And if we get to the end of 18 and we're not getting everything we were hoping to get out of the Epic Sorian marriage, where we evaluate our, where we go next.
Okay.
Are we still going live with Epic at Boone? Absolutely. So we appreciate our Boone colleagues, working with us. But as I mentioned, we are a partner with Boone at least through 2020, and they're on the McKesson system, and that we have to sunset that next a year from now. So yes, Boone will go up live on Epic in August.